Hello, it's Alexa here from Kelowna Now, and I'm sitting down. We're doing our monthly Beyond the Counter with Rutland Medical Pharmacy. Thank you, Stephen Hopp, for sitting down with me today. And we were just talking offline, I don't know, 10 minutes about the topic that we are here to talk about that hits home for me. Endometriosis. Stephen actually sees me once a month, so he sees my ups and downs sometimes. He sees me on social media being loud and spreading awareness. And Stephen has a close one, his wife also, who struggles with endometriosis. So we thought, why not? Let's talk about endometriosis today, as it's something that is affecting 1 in 10 women.
Yeah, absolutely. No, I think it's much more common than people realize. And so many women live with it and never get proper diagnosis or proper treatment. So it's something that I wanted to talk about, and I knew that you would be open to it from our past conversations. And I mean, like you said, Alexa, my wife has it and has had it for a very long time, and so I see the struggles that women go through.
Yeah, maybe at the start we can just talk about a big part of your passion, though, is to promote awareness about women's health. Why is it that women still are not maybe getting the same quality of healthcare that men are?
Yeah, I mean, that could be a whole nother conversation, I'm sure.
Episode 2.
But traditionally, and I don't, it's hard to say sometimes, but traditionally we still live in a society where it's not that long in the past where women were supposed to always be at home. Women weren't supposed to work. Women couldn't vote. And I mean, I'm not meaning to get political here, but those things still kind of creep into society a lot more than we'd like to think. And so there's that part. And because of that, women didn't necessarily see and get medical attention as much, which results in misdiagnosis. Often things were just put off to, it's just your time of the month, which, I mean, this does get much worse when it's your time of the month, but things were just kind of put off to that, blamed about that, and you don't talk about it, right? Yeah. There's still a culture out there for many things, mental health, certainly anything to do with a woman's reproductive system, where women feel like, I shouldn't talk about it. Not all women, which is wonderful that we have women like you that are willing to talk about this and raise awareness. But I think those are some major factors. And if you have anything else to add, because I mean, again, this is a passion for you since it affects you personally, feel free.
Yeah, I mean, I agree with everything you said. It's definitely noticing that generations of women, it's slowly, I'm starting to see it, and females are finally talking about menopause, premenopause. We're finally talking about it. We're finally in clinical trials. I think back in the day too, like, we're more complicated than men. We have more hormones, we grow babies. Like, I think we are harder to figure out. So but I think finally the medical world is like, okay, that's not gonna help a woman because their hormones are completely different than a man's hormones. Like, men change, or their hormones are like this every 24 hours. Women, we've got a whole 28, 29 day of different hormones, different phases of our cycle. So I think it's really important. I am loud about this because I think we just need to stand up for women in general, but we need to stand up for the younger generation, the women that are starting to get their periods, and talk about it and track your cycle and learn more, because I really think that a lot of these diseases that are coming up in women, or we're finally talking about, like PCOS, endometriosis, if you can get on a right lifestyle or get diagnosed earlier, you're going to have better options in your fertility. You're going to have less pain, hopefully. And not, like, I battled this for so long. Like, I have struggled since I was 12. I'm 33 years old. Yeah. And it's getting worse as I age. And I am struggling to get pregnant. So I think the more we talk and the knowledge and the sharing, it's just, you're not alone.
Absolutely. And I mean, I have a daughter, and I hope that she grows up in a world where, women don't have to deal with as many of these issues, or at least when women deal with these issues, it can be talked about. It can be out in the open more, so that she and other girls and other women can get help much more effectively. That's such a big problem, like we've talked about. I mean, um, my wife was only diagnosed with endometriosis. I believe she was in her 30s when she was diagnosed, but she looked back and she had really, really long, rough periods growing up as a teenager, as a young adult.
Yeah.
And many people, including medical professionals,
dismissed her.
would just basically tell you to get tough, kind of the type of attitude. And that doesn't sound very nice, but that's sort of the message that you get told, that, well, this is just part of life.
Yeah.
Take some painkillers, which are something that we talk about and can be beneficial. Even down to, I've heard stories of a PE teacher that she had, who was female, by the way. Not to out, I'm sure this person isn't a teacher anymore, many years ago. I'm not trying to out anyone, but who basically said, I have no sympathy for this. Too bad.
You fail a class or you don't get a grade.
And that's not creating an environment where girls and women feel like they can get help and seek treatment.
Yeah. Well, we've talked in other episodes about mental health, and a huge thing with endometriosis, because it's not just physical, it is emotionally and financially draining. Because you're in so much pain, especially because it's usually once a month that you're feeling extremely in pain, you almost have you gain PTSD from it. You're afraid to get your period because you're wondering, some people have different levels of their pain with endo. Is so complicated, and that's why it's also hard to study. But you could go into the hospital because you actually can't handle the pain. I've been in that situation time and time. I have begged my husband multiple months to take me to the hospital, and I used to go to the hospital. But you get told things like you said with your wife, well, just go back on birth control, take some naproxen, I can't help you, go talk to your doctor. It's like they almost think you're wanting to just go to the hospital to gain drugs or something, or so there's that stigma right there.
For sure. There are those situations where people have been, labeled for they're seeking drugs. Are there people out there who go into hospitals to seek drugs? Sure, but most people don't. Most people go in because there's a valid reason, and certainly we never would. I would never. You would never. No one here would ever want to suggest that anyone who is experiencing endometriosis or suspected endometriosis is doing that. I mean, what we want is for people to understand this better and to get help. And you're right, to your point. There are people who have endometriosis for years. They're lucky enough to have almost no pain and no symptoms. That's rare. But there's been cases where, say, there's been an abdominal autopsy on someone and there's endometriosis everywhere, and they never complained of symptoms of it. But in most cases, people have significant symptoms associated with it, from, as you said, increasing pain at different parts of your period. Often your period can involve excessive and prolonged bleeding as opposed to what's more normal. There can be fatigue, chronic fatigue, pain with bowel movements and going urinating sometimes, of course, significant pelvic pain, pain during intercourse sometimes, and often it can lead to significant fertility problems due to physiologically what the endometriosis does to that part of the body.
I wrote down that it's up to 30 to 50% of women with endo may experience infertility. That's a high percentage.
Statistics say 50%, so it's more on the 50% side from what I understand.
That's half the population having fertility.
Absolutely. And that can be another problem. You might be having
Yeah.
fertility problems, and if you don't know you have endometriosis, I mean, you could be going down the wrong
Rabbit hole.
rabbit hole to try to treat the fertility problems.
Well, and that's why I think dealing with this younger, it would allow you to understand your options. If you want to freeze your eggs, if you know you need to have kids, maybe try younger. I mean, that's where I feel like I've kind of, and many women out there, and it's sad because there's women out there with way less or way worse symptoms and stories than me, but that's where I feel like the medical system has kind of pushed me aside. And finally, if I didn't have the fight in me, I would be probably just on medication right now, and there would be no chance of me getting pregnant. But the good news is I would push for getting into a fertility clinic, because that's where they start to really care and to start to take tests, and you start to get to cross things out. You're like, okay, I finally found out that both my fallopian tubes were blocked, which usually means I'm more in the stage 3, because there's different stages of endometriosis. Absolutely. So both my fallopian tubes were blocked. They were able to do a procedure with me and unblock them. So I right now have the chance to conceive naturally. 4 months ago, I was on my way to IVF.
Wow.
And it also puts you a little bit at ease, because I have been clinically diagnosed with endometriosis. Yeah. So you kind of get that answer of the fertility issues, where, like you said, there's women out there that are sitting there, no diagnosis, and they don't understand, or never got pregnant and never got diagnosed.
Yeah, or you feel like if you don't know what's going on, you can't try to find a proper solution. You're just spitballing, throwing things at the wall and hoping something sticks, right? Whereas if you know, then you can actually seek a solution. And sometimes when people have fertility issues, they feel like something's wrong with me, what's wrong with me? And it becomes a whole nother, a bigger issue. Now that leads to a mental health issue. So actual proper diagnosis and treatment is so important. And to backtrack, the fertility clinic is an absolute great resource to get referred to them. Even if it's endometriosis, you're right, they're focused on certain things, and they'll go down that pathway and help you address the issue, no matter what it is, from my understanding anyway.
Yeah, so how has your wife managed her symptoms? Like, she's still struggling with this. There is no cure.
Yeah.
Right now.
No. It was a long process. They say that in Canada, there's some statistics that say it often takes 5 years roughly of symptoms to be diagnosed, although
I think it's
longer.
Yeah,
there's other reports and statistics that suggest 10 to 12 years of living with this and having symptoms before diagnosis usually happens.
Diagnosed wrong or
exactly. That's part of that process. So she certainly never had the laparoscopic surgery done, which is what they say is the only true way to diagnose it.
Mm-hmm.
They can look at all of your symptoms and say, yes, it's probably endometriosis.
Yeah, clinical diagnosis.
Yeah, exactly. And we're fairly sure that's what it is, because it just fits. Nothing else really fits. Yeah. But the problem with diagnosis is it's fairly invasive, because they have to cut into you. Mm-hmm. They do laparoscopic surgery, so they make very tiny incisions and go in with, it's almost like a tiny wire with tools and a camera on the end, and they can go in and they can either do a small surgery to remove part of it, or at least take a biopsy, take a look at it. She didn't want to have that done, because she was basically sure, and she ended up seeing an OBGYN that said, yeah, we're pretty sure this is what it is. And so she did end up getting some medications to treat it, basically hormonal treatments that can be fairly effective in treating and controlling the symptoms. But in that process, she went through some pretty significant pain, and still from time to time has pain, even though she doesn't have a period anymore due to her treatment, her hormonal treatment. She still goes through cycles where she has pain. And she did end up actually spending some time at the pain clinic at Women's Hospital in Vancouver,
Yeah.
which is, I mean, a whole nother thing. They're amazing there, and we learn things like people, not just women, but we're talking about women here, women who are living with chronic pain. Your body changes. Your body changes chemically. Your body your brain changes chemically, and so your body produces more pain receptors, and the chemicals in your body that result in you sensing the pain start to increase their production, and so now you almost become more sensitive to the pain than you would have been in the first place, and it's not your fault.
Yeah.
So the pain clinic will try to almost teach you how to remap those pain responses. It's quite a process, but so she's been through all of that, and it doesn't make it better, but it helps from a coping point of view. Now, all of this happened after after my daughter was born. So lucky enough for us, it didn't end up impacting fertility like it
I was just gonna ask you a personal question and say, did you guys struggle?
No, I mean, even though in hindsight we're quite sure that she had endometriosis, as I said, from the time she was younger, that ended up not being a struggle when we were trying to have a baby, and when she was trying to get pregnant.
It's great.
It's different for everybody.
No, it's different, right? And that's why endo is so complicated, because you can have it grow on different areas of your body. It's like you said, someone could be covered and have no symptoms, where I could have very small lesions if I did a surgery, but I have these crazy symptoms. It's very interesting to learn that I have tried to fight to get to that clinic. I've been dismissed multiple times. I'm also just in the process of fertility is my number one. Like, I just want to have a kid, so I can't go on any of that hormonal stuff. I can't go on birth control. I can't do any of that kind of stuff. So I'm just trying to focus on, eating better, exercise, yoga, so much yoga, meditating. But probably a year ago, I had 42 days of chronic pain. Like, I actually didn't think I was, like, I'm trying not to get emotional, but I honestly didn't think I was going to be able to get through it. And the gray matter in my brain, my acupuncturist said it to me, because I would see him 3 times a week to get out of this sciatic pain. And he's like, I'm just an emotional wreck. Like, I can't do it. And he's like, well, yeah, your gray matter in your brain has changed.
Yeah, that's what happens.
So I have to spend so much time, like you said, for your wife, trying to trick my brain that I'm not in pain, like affirmations, meditation. Like, honestly, yoga has been a huge saving grace. Like, I'm wearing a TENS machine right now. Like, you come in and I'm not having a good day. I'm at like a 7 out of 10. I'm okay. I'm not puking or anything, but it is trying to distract your pain.
Yeah.
And like, those are those little wins that if you can bring your pain down every, 5%, 10%, it just, the longer you're in that mental state of that chronic pain, that just slippery slope that you.
For sure. Like, chronic pain, and I mean, can see, and anyone watching can see how this affects you. And nobody should have to deal with that without some form of proper treatment. And I mean, I can't say I've ever been in that situation personally. I mean, I've had the closest I can say, I've had a few bad injuries in my life where, I was in pretty significant pain for a period of time, but we're talking a couple of weeks at most, and that there's going to be an end to that. That it's going to get better.
The light.
And even that,
it's
being
hard.
in significant pain for a couple of weeks, it's hard on your brain. Hard on you. It's wearing on you. But so for someone that gets pain like this and may get it at any time, and yes, there's fluctuations, but you have some form of it potentially at any time. It's so tough. And you mentioned, gastrointestinal. If it's okay, maybe I'll go back to explain because there could be people on here that don't really know what is endometriosis, and how can something that is hormonal and occurring, or should be occurring in the uterus, how can it affect all of these things? So, I mean, normally the endometrial tissue in your uterus thickens and breaks down with the cycle, and that's how that cycle helps to create the environment that a woman can get pregnant. Obviously, you go through that cycle with your menstrual period.
Mm-hmm.
Well, when those cells that are similar really are that endometrial tissue that should just be in the uterus, when they occur in other areas of the body, so they can occur in the ovaries, the fallopian tubes, which maybe was what caused your blockage that you mentioned.
Yeah.
In some cases, they can even grow in the bowel, the bladder, other areas in the
Lungs,
pelvic
I've heard.
cavity.
My girlfriend.
Yeah, it's possible even in the lungs. And what happens is you get these cells growing in that area. And when your natural hormones fluctuate, they grow, they get more inflamed. They even believe that those endometrial cells, when they're in the wrong areas of the body, can produce their own estrogen. So they're estrogen dependent.
Yeah.
And that's where treatment is so tough, because sometimes they go in and perform surgery, but it can reoccur maybe in a few months, maybe in a few years, because there's still a few cells left, and they start to grow again with the estrogen. The belief is that in most women, there's something that's referred to as endometrial reflux. So the cells can go back up the fallopian tubes, and that's how they can get to other parts of the body. Usually our body reabsorbs them. Just like if you have an injury, a scab somewhere in your body reabsorbs those cells. So usually your body reabsorbs those cells, but in some cases it doesn't, and that's when this sort of thing happens. And when you get adhesions growing in parts of the body, like in the intestines, for instance, you get, and I use the word adhesion, basically the adhesion is some fibrous tissue, scar tissue that builds up, so it can hold your organs in a way that they shouldn't be, stop them from moving, cause all sorts of problems in there that leads to pain and to things potentially not working as well as they should.
Yeah, I learned something just because I'm always reading about endometriosis. I randomly get, and I think lots of women who have endometriosis, and I never knew what this was till like a year ago. I call them uterus saps. They'll come out of nowhere. Don't really know where they are in the body. Like, is it attaching to an organ and it's just pulling on it? But it actually puts me into, I'll be fine. I could be walking down the street. I could be in a grocery store. Feels like someone's like shoving a metal bar in you. And it's just like you go from like a 0 to a 12 and you lean over like you're gonna throw up. Like, they don't last crazy long, but it is insane pain. And I call them uterus saps. I don't know if you've heard of that or a term.
I don't know of a specific term for that, but it's logical. It makes sense that probably what you have is a spot of
in my
endometrial tissue, endometrium, where it's not supposed to be, and it's affecting either an organ or a nerve in that organ, like in your bowel, and if it's touching on an area where there's a nerve, I can see how you could completely get that feeling, like a zap, a hot feeling, an electrical impulse type feeling. Absolutely.
Yeah, so I think it's really important, if you're listening and you're a female or you know someone, start talking to them about it. Start talking to your doctor about these symptoms. There's like the very basic symptoms that we've kind of talked about, severe period pain. Your periods should not be painful. So that's a red flag for sure. Pain with bowel movements, crazy diarrhea, constipation, pain during sex. Apparently that's not supposed to happen.
No, definitely
Apparently
not.
That's not normal.
But I think, again, it's something where often you would be told, oh, it just happens to some people.
Yeah, it's just a problem.
That's
sad.
Yeah, I mean, there could be other things that could cause some of these symptoms. So hearing this and going, yeah, that's me, that's not a definitive diagnosis, but you should absolutely seek medical attention from a doctor to go down that path to see if it could be that. And there's lots of treatments too, medication treatments or other treatments that can at least help minimize the symptoms, from oral contraceptive pills, so birth control pills, other similar pills that are progesterone only because it's estrogen dependent. Sometimes the treatments involve a small amount of estrogen because that can help to prevent your body relying on the estrogen that your body is producing, which is in a much higher amount.
Yeah.
So you will see small amounts of estrogen in the treatment sometimes, but often progesterone only, which will kind of block that estrogen effect and often eventually stop you from having a period altogether, which unfortunately isn't an option for someone trying to get pregnant. And then there's many other treatments that just basically block the hormones altogether. We refer to them as gonadotropin releasing hormones or gonadotropin agonists, antagonists. I mean, I don't probably need to go into all the pharmacology on that, but
it's complicated.
There's so many treatments out there that you can talk to your pharmacist about whether we can or can't give them to you without seeing the doctor. I mean, in most cases we wouldn't be, but we're there as a resource. And so if you have symptoms like this, I mean, come to a pharmacy that has time to talk to you, like us at Rutland Medical Pharmacy. We're always going to make sure we have the time to talk to you about whatever your problem is. And there's many great pharmacies out there that will. There can be side effects with these. So definitely depending on which one and what is right for you, there can be side effects that come along with them.
Yeah.
You know, when you block the estrogen completely, you essentially go into menopause.
Yeah.
That's what happens during menopause. And so now there's slightly increased risk of cardiovascular disease and problems with bone density. But again, those are things that are manageable. You know, there are other things we can definitely do to manage all of those symptoms. And interestingly enough, sometimes people, if they're past childbearing, they might say, well, why don't I just get get a full hysterectomy, get it out. That doesn't always treat it.
No.
You'd think it would, but it doesn't always fix the problem.
Well, what's the other one called where they like burn you or like? That's even more old school. Like I think they stopped doing that, or they're not really recommending.
No, they still do it.
Ablations?
Ablation. Yeah, the name wasn't coming to me either. You sometimes see uterine ablations done, and it often works for a period of time.
Yeah.
But I mean, usually only for a period of time, and usually the symptoms eventually do reoccur. And it doesn't always work at all. I mean, sometimes yes, sometimes no. It's really complicated.
Yeah.
Unfortunately.
Well, this is why it's amazing, though, just to have you, and especially a man, willing to talk about endometriosis. So thank you. I mean, yes, you're in the medical field and you deal with all these kind of things, but it's so good to get a man's perspective, and especially you have someone that has suffered it, and it helps women like me have a voice, because I mean, that's the whole point of why we talk about this, is so that we can help women build confidence to talk more about it, or lose this tabooness that we can't talk about our cycles, or that women's pain isn't dismissed, that we're not just crazy and moody and hormonal and stuff like that, because there is that stigma of being a female with our hormones.
There absolutely is.
And it's
not fair.
No,
it's absolutely not fair. And you know, I fortunately have always been someone that, and I think especially in my career as a pharmacist, I'm really comfortable being spoken to and talking to about anything. But also having women in my life, for sure. You know, from this to things that happened with my wife during pregnancy and after pregnancy and breastfeeding and all these things that
women are amazing.
Women are absolutely amazing. The things that you do and your bodies do, it's pretty astounding, really.
Yeah.
But the things that I thought I knew and I didn't, and I learned, and things that now, you know, I'm very comfortable talking about, to try to just raise awareness and make people realize that things are okay or things aren't okay, and that, I mean, absolutely talk to me about this. It was, I kind of digress here. I'm getting off topic, but
no.
I remember working in a different pharmacy years ago after my daughter was born and my wife was breastfeeding, and I had a couple of young female pharmacists working for me, and women would come in with questions about breastfeeding and formula and stuff, and they'd want to talk to the female pharmacist, and the young female pharmacist would say, talk to him.
He knows.
He's been through this.
Yeah.
And yeah, so I mean, anything I can do to help to talk to people about these sorts of things, I'm happy to do it and enjoy it.
Yeah, well, and I think it's just super important if you are suffering with lots of pain like this, you need a team. Like that is something like I need a medical team behind me. You know, you need a support system, and everyone's different, so you have to find your fit with everyone. But yeah, like acupuncture I have to do. I love red light therapy. I mean, things will change once I have a kid, and maybe I need, you know, I can go into some hormone stuff, so you'll be supporting me in that. Like, you need a team behind you supporting you mentally, physically,
absolutely,
emotionally.
In a perfect world, healthcare would be like that, where you'd have everyone under the same under the same roof, from a doctor, pharmacist, you know, your physio, chiro,
lifestyle person,
everybody, naturopath. Everyone should work together, essentially a full integrative medicine, holistic medicine related approach, or holistic medical approach. I think on a very previous talk, I talked about my approach to care being holistic, and sometimes people think holistic means naturopath, you know, just plant-based. No,
herbs and tea,
and there's nothing wrong with using that and incorporating that into
adding
your care.
It into your.
But holistic refers to all-encompassing, all types, all approaches, and putting it all together. You know, the way. Kind of the way Indigenous people once upon a time did things.
I love that.
And so I would love to see that. Again, we kind of digress from our endometriosis
I hope
topic,
that the future of healthcare kind of shifts back to that, because it used to be like that. It just seems like it's getting further apart, but we do need everyone working together to help, because you specialize in things and people know different things. Like, there's physio, but did you know there's pelvic floor physio? Like, where all they do is focus on your pelvic floor. I had no idea. Nobody talked to me about it. That was something that was really big and helpful. And if you are, any woman should be just going to that. If you have a baby, a pelvic floor physio should be there when you're delivering. Like, I think they would have a smoother birth if you had that person coaching you, guiding you.
You're probably right.
So we can dream, Stephen. We can dream. Okay, well, I mean, you know me. I could just talk and talk and talk and talk. Did we get all our stats and stuff out?
I think we did. I'm just looking at my notes. So chronic pelvic pain, 50 to 80% of women with chronic pelvic pain suffer from endometriosis. So if you have chronic pelvic pain, it doesn't mean that's what it is, but definitely you should be looking for help. And actually, you know, the one thing I don't think we mentioned, so the World Health Organization and many other organizations, if you're not a fan of the WHO, say that definitely 10% of women worldwide are affected by endometriosis, but the real statistics, because of lack of diagnosis, would indicate that it's probably at least 20 or higher of all women out there that have endometriosis. I've seen some suggestion that it's closer to 50. I mean, that may medically be a stretch to say that, but 20% is quite likely.
Well, I'd say 10% is so low. Like, now that I've been talking about it, or the reason why I think I got diagnosed, or I diagnosed myself, but at first, is a girl that I used to work with. She watched me struggle, and she's like, I have to tell you this. I think you have endometriosis or PCOS or something. I have it. Everything you're going through, that I can see you're struggling to be at work, like you're on the floor, I think you need to get checked out. That was the first time I heard that word.
Yeah, so someone that was willing to talk about it. So that's so important.
But the more you talk about it, the more I'm like, okay, she has it, she has it, she has it. So when you say the percentage, It's definitely more than 10%. It's the late diagnosis.
Yes.
Women not going and talking about it because they've been dismissed. If you're not a fighter, you're not going to get answers.
Yeah. No, there's based on autopsy reports, on which is a very small subset of medical reports that they can have. That's where there's some belief that it could be as high as 50%, but certainly higher than 10. And that's, I think, where reliable medical organizations will be saying it at least 20% or higher now. And then the other thing anybody who has a uterus, so you can be transgender, non-binary. It's not just people identifying as women that can have endometriosis.
Yeah, which is crazy to think that the percentage is even worse.
Absolutely.
Well, Stephen, thank you for always being a pleasure to talk to and being so open and letting us shine some light on women's health. And I think we just want to say to the audience, if you are struggling with some of these symptoms, I mean, Stephen's team is always here supporting and there for questions. I really love the way that I think most people, it's like that stigma of pharmacies of pill popping, pills, pills, pills. But you are just part of the team. You are part of my team. So go ask them questions. Or, I'm not a medical doctor, but I have learned things through my experience. And if I can even help guide your teenage daughter from waiting a little bit longer, or just want some advice, or you just need to chat, it's a lonely world in chronic pain, so I'm also here. So feel free to reach out to any of us. And yeah, Stephen, thanks again so much for letting us discuss endometriosis.
No, thank you for having me. And yeah, if you can be a mentor to people, I mean, Alexa, you'd be an amazing mentor for people with topics like this. And we just want to be there to help people and make communities healthier. And however we can do that, I would love the opportunity to do that with you, with people, and walk with them and help them.
Okay, awesome. Thanks. Have a good afternoon, Kelowna.